And so we do see it impact the whole body. And that's why it's often thought of as like a chameleon of so many different conditions and diseases, is because it really can impact everything. And so in that instance, it can be very hard to diagnose when you're going to your doctor and you're talking about, maybe I've got headaches and migraines. Your doctor's not thinking of like a traditional GI condition like celiac disease. And so sometimes it can be missed in that way.
There is a lot of confusion about gluten in the gut health world. If you've been navigating gut issues for a while, you may have explored a gluten-free diet or perhaps done a low Fodmap diet that involves limiting many foods with gluten, like regular breads and pasta. Gluten is a protein found in the grains wheat, spelt, rye, and barley, and it is not a Fodmap. While intolerance to gluten can exist on a spectrum, a very real and life-changing disease that requires a strict, lifelong gluten-free diet as the primary treatment is celiac disease. Even ingesting small amounts of gluten, like crumbs from a cutting board or toaster, can trigger small intestinal damage for those with celiac disease. If you're tuning into this episode and you have celiac disease, you know that it can be incredibly difficult to manage. According to the Celiac Disease Foundation, the treatment burden of celiac disease is comparable to end-stage renal disease, and the partner burden is comparable to caring for a patient with cancer. Untreated celiac disease can lead to the development of other autoimmune disorders like type 1 diabetes and multiple sclerosis, and several other conditions including anemia, osteoporosis, infertility, migraines, heart disease, and even intestinal cancers. If you've been living with celiac disease or you suspect that gluten might be a culprit in your digestive issues, you're going to want to tune into today's episode. We'll discuss what celiac disease is and the difference between gluten sensitivity and fructan intolerance, a typical day in the life of someone with celiac disease, the link between celiac disease and IBS, and top tools for navigating celiac disease in 2026. Helping me break this all down is Selena Devries, registered dietitian and founder of Celiac Made Simple. As someone living with celiac disease herself, she brings both professional expertise and personal experience to her work. She's a graduate of the University of British Columbia and has completed Monash University training in the low Fodmap diet. For more than 10 years, she has specialized in empowering people to stop merely managing a gluten-free lifestyle and start enjoying it. Through education, support, and real-world strategies, she helps clients create a more confident and fulfilling life with celiac disease. Without further ado, here's my conversation with Selena Devries all about celiac disease, gluten reactions, the link to IBS, and more. Hello, Selena, and welcome to the show today. I'm super excited to have you on and talk all things celiac disease.
Yes, well, thank you for having me. I'm happy to be here.
So you're known as a leading celiac dietitian and also the founder of Celiac Made Simple. So for our audience members, can you take us back to a time maybe where, things really started for you and you decided to open up your practice focusing on celiac disease as a dietitian?
Yeah, so it probably started honestly with my own diagnosis. I was in just before internship year, actually becoming a dietitian. So it was my last year of school and I was very, very tired. And I just thought, it's internship year. it's tiring year. And I blamed it to that. And then I was just exhausted. So I went to the doctor and got tested for, iron deficiency and low iron. It was just slightly low. And, the GP that I saw was a walk-in doctor at the time. And he mentioned, hey, let's just screen you for celiac disease because his mother-in-law had celiac disease. Yeah. And so it did come back positive, and that led to the endoscopy with a gastroenterologist and that positive diagnosis for celiac disease. And then I went to my doctor, to get that final report and the diagnosis. And he said, okay, well, you're almost a dietitian, right? So, this will be easy for you. Just eat gluten-free. And I was like, Okay, like certainly I have a leg up, versus a normal person, but that was not the support I was hoping for. I was hoping for a little bit more. And I think that first year was a very turbulent time in my diagnosis. It was, filled with a lot of anxiety, a lot of overwhelm. And certainly as a dietitian, if that hit me in that way, like what is happening to everybody else that is getting their diagnosis? And so that really led to my passion for celiac disease and wanting to help our community, just have better support, better care so that they could have a better quality of life with celiac disease. Because when you don't get that support, and I'm sure in your area as well, like life can feel a lot more limiting. So that's what led me to open up my private practice in celiac disease and to work with individuals with celiac disease that they could have more freedom living gluten-free and have more confidence in having a better life with celiac disease.
Yeah, absolutely. Okay, that's quite the story, and I'm sure lots of clients resonate with your story as
Yeah.
well. Yeah. Do you find a lot of times, like with, getting diagnosed with a medical condition, sometimes there's a bit of like, that maybe not wanting to accept it in the beginning? Did you find that it was just kind of like, you felt like, where did this come from? How could it be me? And just to find like it just took a while to really accept what you needed to do? Or what did that maybe like first month or two?
Yeah, I definitely was happy with the diagnosis. And I see this with clients too. It's like you're kind of, oh my gosh, like I've been feeling so unwell for so long and I finally have the answer. And now you have something that you can do to feel better. And I think that's kind of where I landed. But with that being said, you're a few months into it, following a gluten-free diet, it's a lot. And, we'll talk more about this, but I think when you start to ask questions all of the time and you're navigating food plans all of the time, it can start to feel a little bit exhausting. And that is where I think I wish that I had that support so I wasn't constantly second guessing myself. Because a couple months in, at first, I was like, yes, I know it's gluten free. I'm going to go into the gluten free diet. But then I started to feel really overwhelmed. Then I started to feel really exhausted with all of the mental clockwork that was happening in the back of my head, questioning myself about cross contact. So I think there is like, I would have loved to have the support so that I could start off on the right foot and not feel so overwhelmed that first year. Um, so yeah, I think that's where I landed.
Yeah, that makes sense for sure. And as we'll get into, it's not just, as easy as, picking gluten-free products off the shelf. There's a lot more consideration and even making sure you're like repairing any damage that was done in the time where maybe it hadn't been diagnosed and you were still eating gluten. So yeah, lots to consider. I think it is really great though that that walk-in doctor decided to screen you for celiac disease. It's definitely more common in recent years for people to be suggested to get the screening. But I've had clients who were maybe diagnosed, 10 years ago, and they waited a long time to get that diagnosis and told it was, just IBS or something else going on and weren't screened for a long time. So I think it is good that that doctor did
Yes.
just that at the time. So definitely.
So true, because it's definitely not a common thing for a GP to just screen with like a slightly low iron level. So I was
Mm,
very, very thankful to that GP to catch up.
yeah, for sure. Were you having a lot of GI symptoms or it was more just the fatigue?
The fatigue and the brain fog was a big one for me. And then I did have, I don't think I really realized it, to be honest, at the time, but I did have a lot of constipation and bloating and didn't realize the severity of it, I would say, until I went gluten free. And then also those symptoms seemed to have lingered on. And then once I got control of those symptoms, then I was like, wow, is this how you're supposed to feel when you wear jeans? And have them actually feel comfortable versus having to change out of them at the end of the day. So I think I didn't realize the impact of that until a few years into my diagnosis.
Mm-hmm. And yeah, it sounds like you had sort of atypical symptoms. A lot of people, and even doctors too, associate it more with loose stools and diarrhea, and
Yes.
constipation not being, I guess, a red flag for celiac disease. So that's really interesting and a great story. Just so we're all on the same page, can you explain what celiac disease actually is, and maybe reference to what it isn't, or it sometimes gets confused for?
Yeah. So celiac disease is an autoimmune condition that causes damage to the small intestine and then leads to malabsorption of different nutrients, and that can cause body-wide symptoms. And so basically, if you are not yet diagnosed and you do have celiac disease, you consume gluten, the body reacts to that like a foreign invader. And so gluten is a protein. It's found in glutenin and gliadin. And when that comes into the body is like, okay, this is bad. I want to attack this protein. And then somehow in the mix up there, it has a mistake happens. And instead of attacking the protein, the body then goes into an autoimmune process, hence the word autoimmune, and it attacks the small intestinal villi, which are these little finger-like projections that absorb and snatch up nutrients from what we eat. And it damages these villi, and they can, over time, when you eat gluten, these can go completely flat in celiac disease. And so then that you're not snatching up those nutrients as often, and we get the malabsorption of common nutrients like iron, calcium, vitamin B12, vitamin D, and then this can lead to body-wide symptoms. So we can get the typical GI symptoms, which are actually, to be honest, much more atypical now. It's not as common as they used to be years ago, but we can get things like diarrhea, loose stools, constipation, bloating, abdominal pain. We can also get fertility issues. So for example, unknown cause of recurrent miscarriages can be a sign of undiagnosed celiac disease. There can also be other reproductive issues going on. So we can see connections between endometriosis as well as like heavy periods and that type of thing with celiac disease, body aches and pains, headaches and migraines, neurological symptoms. And then it can impact children as well. We can see things like sleep issues, behavioral issues, growth issues. That can happen with children. And so we do see it impact the whole body. And that's why it's often thought of as like a chameleon of so many different conditions and diseases, is because it really can impact everything. And so in that instance, it can be very hard to diagnose when you're going to your doctor and you're talking about maybe I've got headaches and migraines. Your doctor's not thinking of like a traditional GI condition like celiac disease. And so sometimes it can be missed in that way when you're getting some of those atypical symptoms.
And I think there's a large genetic component, right? So typically people would or should be screened if they do have like a first relative with celiac disease. Do you find like you see that doctors generally screen patients with that family history, or do you see sometimes people being missed with that?
They should be screened. Primary family members have about a 10 to 15% higher risk of developing celiac disease. But I do feel that if you're not in a major celiac center, this is not often being done. It is being missed. So sometimes, whether that's working with your doctor and bringing in, recommendations from Celiac Canada, or working with a dietitian or a different healthcare professional, sometimes that advocating for your client needs to happen so that the whole family is getting screened. So like children, siblings, parents, once somebody has that confirmed diagnosis, everybody should be screened in the family, regardless of symptoms or not.
For the testing, though, you do need to have been eating gluten for a period of time to have like the antibodies show up in the blood work and the test to be valid. So it can get a little murky too sometimes if people are exploring gluten-free diets on their own, or even sometimes they'll do low Fodmap and also eat gluten-free, which I think you would agree that it's always best to rule it out first before you try any elimination diets, because it gets harder to spot after that.
Yes, absolutely. It's so key. And I think that gluten challenge too is like, before you even go down that route, I totally agree. Like you want to be eating all of the gluten to get that accurate test for TTG because it's dependent on eating it. But once you go off, going back and doing the gluten challenge, I often find that even clients that are trying to eat the gluten every day, they're not eating enough for enough time. So you actually do need to be eating a good dose of gluten, anywhere, depending on the challenge that you're doing. It needs to be anywhere from like 2 to like 5 to 6 slices of bread per day, or the equivalent. And so if you're not doing the bread, then we need to be very like accurate in terms of the portion sizes of whether that's a bagel or a wrap or crackers or noodles. So it's not just like eat it once or twice a day. It's the portion starts to become really important there.
Yeah, definitely. Which can be challenging, like if someone, did experience relief with their symptoms when they try a gluten-free diet, to then ask them to eat gluten again,
Yeah.
can be a lot of like mental burden. Do you have anything that you kind of share with your clients in that situation just to help with more the mental side and getting through it, or?
It's a tricky one, to be honest. And I think often I will talk about their family, right? So it's like, well, if we can get a firm diagnosis for yourself, like we can then potentially catch this earlier on for, your brothers, your sisters, your kids, your parents, and we can reduce those risks of long-term consequences of, you know, eating gluten long term when you need to be gluten free. So I often talk about the importance there. It depends on the person and what's important to them. I often try to cater the conversation to that. But I do talk about, if we catch this, then we can also then get the gold standard treatment, right? So like for celiac disease, we can there's appropriate follow-up for nutrient deficiencies and following this up yearly. Or even in the future, there's probably in the next 10 years might be a medication that you could take, for example, for cross contact in a restaurant. So so to be able to qualify for that, you will likely need to have a gold standard diagnosis, meaning the positive TTG and the biopsy. So talking about it in those terms can sometimes make them think, okay, like I can get through this, or like looking at different food products. So like even doing like the gluten powder, like the Bob's Red Mill Vital Wheat gluten, you can sometimes get a smaller amount, like 1 teaspoon, but like throw that into a smoothie and it not be like such a substantial amount that you have to eat in terms of bread or like pasta. Always catering it to what the biggest challenges are. But I agree. It's a tricky conversation once you've kind of taken it out already. You need to go through that process. It's usually not comfortable.
Yeah, for sure. And I shared a statistic when I introduced this episode, but according to the Celiac Disease Foundation, the patient burden of having celiac disease is equivalent to end stage renal disease, where there's a lot of nutrients that you have to be mindful of limiting in your diet. So as you said, it's a lot of mental, work and calculations. So having celiac disease yourself, and obviously working with many clients with the condition, can you sort of describe maybe a typical, day in the life of someone with celiac disease trying to live a gluten-free lifestyle? Maybe
Oh gosh.
the choices or the considerations they'd have to make that, those of us without celiac disease sort of take for granted.
Goodness, this is such a good question. I think, a lot of people, when they think, celiac disease, it's eat gluten free, right? Eat gluten free. And of course it is. But I think something that many people may not totally understand or relate to is the cross contact piece. Where with celiac disease, yes, we need to eat gluten free, but we also need to pay attention to how gluten free foods are prepared or cooked so that they don't come into contact with gluten, like tiny amounts of gluten in that process. And that's probably the biggest piece that celiacs struggle with and creates a lot of that mental clockwork in the day. Because, for example, you wake up in the morning, you have both gluten and gluten-free in the house. You got gluten eaters and gluten-free eaters. And you go and you want to make breakfast. You're making your gluten-free toast with peanut butter. And now, okay, yeah, it's gluten-free, both the peanut butter and the toast. But was that peanut butter just double dipped for the people who are eating regular bread? Right, so we're thinking about cross contact. Or what that comes up quite a bit with clients is like, I'm so scared now I see regular crumbs on the counter. Now I have to wash everything down, right? So it's not just, yes, this is gluten-free, but now I'm thinking, okay, I've got to prepare it safely. I've got to now wash down the cutting board. I got to ask people, did you put your knife into the peanut butter on that regular bread? And now is that peanut butter contaminated? So that would be like a breakfast situation, for example. Or another really common one is navigating restaurants. So let's say you're going out for lunch. Well, it's not often as simple as just stopping anywhere where you want to go. You might need to research restaurants in advance to know where is a safe restaurant that not only offers gluten-free options, but can prepare those in a celiac safe way. So before you even get to the restaurant, you might need to be calling around to different places to see if they can accommodate that. You might be using a different app or Google to Google different restaurants to see where you could eat safely before you actually get there. Or sometimes people might be packing their own food along versus even stopping at a restaurant because they don't want to deal with that situation. The other aspect might be, okay, well, you're invited over for dinner at your in-laws, right? Well, it's not as simple as just saying, yeah, that would be amazing. It's now we need to have a discussion about what you're making in advance so that we can make sure that it's both gluten-free and then prepared safely, right? So I think a lot of people, when we're thinking gluten-free, and this makes sense because if you don't know, you don't know, right? But they often think it's like the bready stuff, the pasta stuff, right? And gluten can sometimes hide out in unseeming places like broth or bouillon cubes, for example, is really common. So we might need to ask, well, if you're making stew, are we putting any broth or bouillon cubes in there to ensure like all of the ingredients are gluten free? And then, of course, I think what comes up really often with clients is that if it's not just yourself living with celiac disease, if you have young children who have celiac disease, the mental burden can start to become quite a bit. Because if you think about kids, what do we got? We've got sporting events, we've got school, we've got play dates, we've got birthday parties, we've got sleepovers. And so often the parents are trying to think, well, where can I get safe gluten-free pizza? Or I've got to pack their pizza and I've got to go buy a cupcake for their birthday. Or I've got to make sure that the teacher has safe gluten-free treats at the school if she's handing out treats so my child's not left out. Or I've got to make sure that they have gluten-free Play-Doh in case they're playing with regular Play-Doh in the school and my child's not going to be left out. So we've got to make sure that we have the safe Play-Doh or modeling clay that they can use. Sometimes that might become a concern. And so it's not just, as you can see, I'm going through all of these scenarios. It's not just, the gluten-free. It's a lot of it is like the invisible food decisions that are happening behind the scenes before food even comes into play. It's a lot of that planning and researching that many people might do ahead of time to ensure the day goes smoothly.
Yeah, a lot to understand there. And I think even someone who's, newly diagnosed with celiac disease, it can be a bit of a learning curve to learn where gluten is and where it isn't. And, we mentioned some of the common grains, so rye, barley, and wheat, but there's a lot of like derivatives of wheat and the ancient grains that go under different names that a lot of people don't even realize have gluten, right? Like farro, einkorn, spelt, kamut pasta. So there's quite a lot, I guess, to understand, and it can be difficult if maybe you're eating at someone's house and they're not as well versed in a gluten-free diet and what to spot.
Exactly. And I think it is about that support in the beginning because there is so much to learn in that first year. When you really get the tools and the strategies to stay safe, like a lot of this, it doesn't disappear. But a lot of this mental thought work can drastically decrease when you have supports in place, when you know how to navigate it, when you're feeling confident in your skills to know how to read a label. Like, for example, like what you just mentioned, is there's so many other names for wheat, and there totally is, right? But in Canada, we have such great labeling laws that you don't have to remember all of these different names for wheat or search for all of these different ingredient names on packages because it is very simple to identify in Canada if the product has gluten or not. So we are very lucky in that way, but it's still a skill that you need to learn. Like with the label reading one, if you really nail that down, that can be a huge time saver and really help with navigating some of these situations that we just talked about.
And you mentioned the Play-Doh too. So obviously, well, I don't know, do kids ingest Play-Doh often or?
Yeah, so this is
Yeah.
definitely a controversial one. I would say in daycare would be more of the situation where they're younger
Yeah.
and they might eat the Play-Doh, or they put it like on their mouth and stuff. And so that would be a situation where we might say, okay, because the risk is there that they might actually, ingest it, then we might want to have that gluten-free modeling clay, for example, right? But kindergarten, like once they kind of reach elementary school age, they're pretty well versed in being able to know don't eat the Play-Doh. And so for my clients with kids who are in elementary school, for the inclusion aspect and from the research aspect, we know that with Play-Doh, you can play with it, you can wash your hands with soap and water, and even if you didn't, for example, like in this one research study where they had the kids play with the Play-Doh, then they took gluten-free bread and they wiped it all over the tables to see if it would pick up the gluten. And actually all of them, except for one that had a pea-sized amount of Play-Doh on it, they all came back to test celiac safe below 20 parts per million.
Wow.
Yeah, which was very, very, very surprising because this question comes up all of the time. And even though like you have a child that is playing with gluten-free, let's say modeling clay, and the rest of the kids are playing with the regular Play-Doh, it's still different. The kid still feels different, and that they're doing something different than their peers. And so if we can help them feel included and also stay celiac safe by knowing that if we just wash their hands with soap and water after, they're completely fine to do that, that's an amazing thing for the child to be able to play with the same Play-Doh as everybody else. Then we stay safe, we wash our hands after. So yeah, so those are two different scenarios where we say, okay, maybe we might have gluten-free Play-Doh, but when you're older, you're probably fine with regular stuff. Just washing up after.
And how do you approach like body products? Toothpaste, body lotion, sunscreen, with both your adult and pediatric clients?
Yeah, all good. You
Yeah.
are safe. Use any one that you want.
You don't need to be gluten-free
No.
body butter.
No, you definitely don't. So gluten is too large to be absorbed through the skin. So it can't get into the small intestine by rubbing it onto your skin. And you would have to ingest so much toothpaste if there was gluten in it, sun lotion if there was gluten in it. Like we're talking like bottles and tubes of ingestion, not just like a little bit, like bottles of it. And you would be sick from obviously way other things if you were eating suntan lotion or bottles of toothpaste. And so we do know that that risk of harmful gluten ingestion with something that you might put on your lips, like lipstick or chapstick, or maybe you're ingesting a little bit of toothpaste as you're brushing your teeth. All of those things are nothing to worry about in celiac disease, that you can use any variety that you want and stay completely celiac safe.
I think that's where it's good to speak to an expert to kind of sift out what's just marketing, because if you go to like, a health food store and they have the body products there, a lot of them are labeled gluten-free, but does it really matter at the end of the day? No. It's kind of similar to lactose-free butter, right? Like we know that butter virtually has negligible amounts of lactose, but they make the one lactose-free so they can charge a little bit more.
So it's a marketing scheme for sure.
And confuse people, but no, it's great to hear. I guess since working in dietetics and working with celiac disease, how do you feel like maybe the landscape has changed in the last 10 years, just in terms of, resources available, maybe awareness of other practitioners, awareness of the general population? Like, what would you say are maybe kind of the key changes you've seen, since you started to now?
Definitely way better food options. I was diagnosed 13 years ago, and there was one loaf of bread in the freezer section, and like the sizes of bread were like this small. Okay, so they were, so you could not make a sandwich with that. And so now you've got like full aisles of gluten-free foods, freezers full of gluten-free foods. And that is like so big and so awesome to see with the uprise of the diagnosis of celiac disease. And also I think there's the gluten-free fad that has played into that a little bit as well, right? Then the other thing that I think is awesome is the labeling laws that came into Canada in 2013. So this really helped to label reading a lot easier and identifying gluten literally using 4 words: barley, rye, regular oats, or wheat. And so if you look for those words on labels, they're completely celiac safe. Then I think more restaurant knowledge. So although we have a lot more that could be improved, many more restaurants are offering like gluten-friendly menus or gluten-wise menus that certainly do make it easier. It's not fully celiac proof, but it makes it easier to find celiac safe options when you're dining out.
Yeah, and definitely, yeah, even, whole bakeries or restaurants dedicated to being celiac safe. I know we have a lot in Toronto. I'm sure you have a lot over in BC as well.
Yes, I love the gluten-free bakeries. I am such a dessert fan. And so wherever I'm going when I'm traveling, it's like, where is the closest gluten-free bakery? Bring me there right now.
So for myself, I have been eating gluten-free for almost a decade now. I think what I've assumed is non-celiac gluten sensitivity. So I'm going to ask you the question that I'm sure everyone wants to know. What's the difference between celiac disease and non-celiac gluten or wheat sensitivity?
So I think the big difference between these two conditions is that celiac disease is that autoimmune condition that's causing the actual physical damage to the small intestinal villi, whereas non-celiac gluten sensitivity, it might cause the same discomfort and symptoms that can often coincide with celiac disease, but we're not seeing that physical damage occur in the small intestine. And that would be like the main differences between the two.
And I think the level of being aware of, as you said, the cross-contamination and, the threshold set, the 20 parts per million of gluten is, needing to be way more strict with celiac disease, just because even those trace amounts can cause that damage. Which we haven't gotten into, but people with celiac disease, especially if it's unmanaged, are at higher risk for other conditions too. I think I was reading on the Celiac Disease Foundation website that they're at, is it 2 or 4 times higher risk of small bowel cancers as well?
Oh, yes, with undiagnosed celiac disease. Yeah,
Yeah.
so if you were to totally ignore your diagnosis and not eat gluten-free, then you can get an increased risk of small intestinal cancer. Yeah.
Yeah. Crazy. So,
Yeah, so it's pretty nuts.
yeah. So even going back to just the day-to-day of someone with celiac disease, there's definitely the food considerations and navigating social situations. But I can imagine there'd just be, for some people maybe who are, let's say, their health is constantly on their mind, maybe also the mental burden of just worrying about, negative outcomes of having celiac disease, or worrying if, something else will happen because of that condition. Do you see that a lot too with your patient population?
I definitely see the worry and the mental burden around the cross-contact piece for sure. And I think you kind of hit the nail on the head there, is with like non-celiac gluten sensitivity, you don't really need to worry about that, right? The cross-contact piece, whereas celiac disease, you do. And then that starts to impact everything that you do when you leave your house, right? Is that you start to worry, well, am I getting, or if you have persistent symptoms, you're like, well, was I just glutened at the coffee shop when I had my latte, right? Or, did I eat something wrong at the restaurant for dinner? Or I explained cross contact, but they did not actually get it when I was talking to the chef, right? So it's like all of those questions that kind of start to come about in your back of your mind. And I think this is quite prevalent with clients who have persistent symptoms with celiac disease, and also newly diagnosed who don't get the support or are unable to get the support from a celiac specialized dietitian, and are often in like gluten-free Facebook groups and trying to learn the ropes in that way, which can be a whole other conversation.
Definitely, yeah. Yes, I see that a lot with my IBS and low Fodmap clients. Yeah.
Yeah.
So much great advice on Facebook and Reddit threads.
Yes, exactly.
So speaking of IBS, I do myself have clients with both celiac disease and IBS as like formal diagnoses. What would you say maybe is the link between these conditions, and why, both can occur rather than it just being celiac disease on its own?
Yeah, this is really great because I think it's a huge issue, persistent symptoms in celiac disease. About 40% of people with celiac will go on to struggle with persistent symptoms, and that is quite a stat. A lot of them suffering with IBS. And I think, I see kind of two sets. Is prior to even getting diagnosed with celiac disease, they've seen their doctor and the doctor is saying, okay, well, it's IBS, it's IBS, it's IBS. And then 10, 15 years later, they actually get screened for celiac disease, and then they get the celiac diagnosis. And that was the cause of all of their symptoms. And I think kind of like we alluded to before, is like those symptoms can be so similar between celiac disease and IBS, especially those GI issues, that it can be hard to differentiate it. Often coming down to like, my GP doctor who was the walk-in who was like, let's screen you right away. So often it will come down to like the knowledge of the GP, and it's better now to screen, but still it can sometimes be missed for many years and just told that the client has IBS. And on the other side of that, you can get your diagnosis of celiac disease and then still, a year later, year plus later, struggle with ongoing symptoms. And I think a lot of those times it can be IBS. And like one of the research articles I was going to talk about later on is like there could be a potential disruption, right, in the gut microbiota that can maybe make somebody more susceptible to whether that be IBS, or there might even be other conditions going on that are leading to IBS-like symptoms, which can also be common in celiac disease. And so I think if that's IBS, it could be, but it could also be other things like lactose intolerance is also very common in the newly diagnosed because of that damage in your villi, and these villi create that enzyme to digest lactose. And so if they're damaged, right, they're not making it as much. And so we could have like a secondary lactose intolerance develop. Something else that's super common in celiac disease, if we have like ongoing diarrhea or liquidy or watery soupy stools, it's microscopic colitis. This is very common. Or of course, there could be ongoing cross contact. And this is what the research tells us. If you're having ongoing symptoms, research is telling us that this is the most common cause of ongoing symptoms. I can't say I see it super often in my practice. I do screen for it all of the time. And so that's something that we would want to look at as well. Something that I also see is super common, and you probably see this quite a bit too, whether it be IBS constipation or chronic constipation. I see chronic constipation a lot in celiac disease. And then, of course, IBS is also very common. I would say constipation and IBS are probably the top two things that I see in my practice.
And yeah, from what I've seen as well, is that even people who adopt a gluten-free lifestyle diet may still have symptoms for a few months after. Is that something that you see as well, just while kind of things are healing and the small bowel is restoring itself to its normal function after, needing to tolerate gluten for a long time?
Totally, yes. And that's the thing is I think sometimes it's important to put those expectations in place for how long it's going to take it to heal with celiac disease. It doesn't happen overnight. It doesn't happen weeks. It's often going to take months to heal on a gluten-free diet. And I say we want to give it the diet time to work. And we don't want to look at those persistent symptoms and start to blame it on other things yet until at least 6+ months on the gluten-free diet. And that's where we would start to explore some of these other conditions of like, okay, if we're not getting better and it's been 6 to 12 months on the gluten-free diet, now let's start to look at all of these other areas that could potentially be contributing.
And on a previous episode, I spoke with another dietitian about nickel allergy and systemic nickel allergy syndrome. And we both kind of talked about how we are seeing a little bit of a link between celiac disease. I think now I've had 1 or 2 clients with both celiac and nickel allergy, but I was wondering if that's something maybe you've seen at all in your practice or kind of explored.
I have not come across that yet.
Okay.
Yeah.
Interesting.
Something I will keep my eye out on. Yeah, I say too, like naturally, like the clients that I've taken on very much have symptoms of like the constipation, like that picture. And so that often is the root cause, but I will never rule anything out. I think you're always learning as a practitioner. And so that's something I need to learn more about.
Yeah, a little like a good maybe indicator for that one is if they are, they have IBS type symptoms and they do have celiac disease and they've been on a gluten-free diet for a long time, but they seem to react to like low FODMAP foods. So things like spinach, brown rice, low FODMAP portions of nuts and legumes. They are all like high nickel foods. So it's kind of interesting. Yeah, we won't go too far into it, but I was just curious if you've seen that. And for anyone listening, you can backtrack on that episode if you're curious about that as well. So that's why we love GI, right? It's so complex.
Oh, totally. Totally. It's so complex. You never stop learning.
So yeah, with celiac disease, I know you mentioned it can also be linked with other conditions that aren't necessarily GI related. So in terms of the link to, autoimmune diseases, what, other than seeing the GI conditions, do you see kind of an overlap with any other autoimmune conditions in your clients?
Yeah, I would say the most common one that I would see is Hashimoto's thyroiditis. This is really common with celiac disease. They're just naturally at higher risk of developing autoimmune conditions, but particularly this one. And so the recommendation, from Celiac Canada and for follow-up care in celiac disease is to always screen the TSH every 2 years, or earlier. You would be screened earlier if you actually have Hashimoto's thyroiditis. But to always look for that in follow-up care for celiac disease because it is quite common. So I would say that would be the most common thing that I see among clients is Hashimoto's thyroiditis. On the flip side, there is people with type 1 diabetes seem to have a much higher risk of developing celiac disease, but the reverse is not true. So if you have celiac disease, you're not at a higher risk of developing type 1 diabetes. It just seems to be in that population where they now just automatically screen anyone with type 1 diabetes, you're automatically screened for celiac disease because that relationship is so tight.
Yeah. And it could be others as well. But yeah, I think I've
Yes.
seen even endometriosis, sometimes multiple sclerosis. So the list goes on. It's such a complex condition.
Oh yeah, there are so many autoimmune conditions. I think it's hard to put the nail on the head of which one is most common than others, but there is a long list.
So what would you say in 2026 are your favorite tools, maybe top 2 or 3 tools for navigating celiac disease?
So, okay, this is not a tool, but I have to say it's like very, very helpful. And that is being able to label read without having to Google all of the ingredients. So yes, it's a skill. You got to have that label reading skill. So like a lot of people use those scanner apps. And I would really encourage people not to use those scanner apps in the store because they're often pulling inaccurate data, whether that be from the US or they're using an outdated version of the label. It's not the actual new label in store. And so what's always going to have that most up-to-date information, it's never going to be a scanner app. It's not going to be a website. It's going to be that label right in front of you in the store. So scanner apps, not the best, but building those skills is helpful. For the other 2 things that I think are really helpful, I love the app Find Me Gluten-Free. I think that can be an awesome app for traveling. They've also added in, some really cool things lately, which is different, like asking restaurant questions. So again, around the cross-contact piece in different languages, which is very cool. So if you're in, anywhere where you're traveling, you can kind of pull up the language. It'll give you all of the restaurant questions, and then you can click the restaurant question that you want and just literally like flip it around and they can understand what you're saying. So I think that's really neat. The other thing that's really helpful for travel is like those Equal Eats, that brand I particularly like for celiac disease, they're translation cards. So it's literally a little card that you can either download as an app to your phone or you can order them online. And it literally, you just hand this to restaurants. It tells you what you can eat that's gluten-free. And it also has like a little phrase in terms of the cross-contact risk. So, making sure you're using clean pans, utensils, fresh frying oil. It's just like a little one tiny card, very digestible for restaurants. And so that brand is really nice, Equal Eats. And then the final thing that's really handy, that's just for your own hometown, your own location, is really being able to navigate and understand how to find these online allergen menus. This can really help to improve convenience, spontaneity, and eating on the go, which is a huge struggle in the celiac community. So for example, when I'm saying online allergen menu, I mean like if you were to go to Subway, you could scroll down to the bottom bar there and it'll say on nutrition info or allergen info. You could click that and it'll bring up everything that is gluten-free by ingredient. And that is like very handy when you're trying to navigate on the go options. And so those hundreds and hundreds of restaurants have these, but you need to know how to find them on websites. When you do, eating out can start to really look a bit more spontaneous versus researching all of the time.
Mm-hmm. Awesome. So what you're saying is there's no, quick tool just to give you the answer right away. It is important to have the knowledge and the understanding so that you feel more confident about making the right decisions and not just relying on, an app or
Yes.
a program.
Yes, exactly. That's the thing is like, I wish, it would be nice if you could just look at a review on Find Me Gluten Free and like totally trust that. But I think like they're a starting point. They're
Yeah,
always a starting point, and then you do need to still ask the questions and know how to navigate the situation.
for sure. Things change. Ingredient labels change, even restaurants change like ownership or management or staff. So yeah, I think it's always good to still double check everything too.
Always, always with eating out.
Cool. I know you mentioned the Plato study, which I thought was pretty interesting. I didn't even, the idea of doing a study on that hasn't even crossed my mind. As you can tell, I'm not a parent of a child with celiac disease, but it's interesting. Would you say, or yeah, if I were to ask you, what's one really interesting study finding maybe you've seen in the last like 5 years around celiac disease and or GI that stood out to you?
Well, the other one that I really love, to be honest, is there was, and you might laugh at this, but there was a kissing study that
Oh,
came out with celiac disease. Yes, because
yeah, that's
like
fair.
these are like the real questions that the celiac community is asking, right? And they are very concerned about cross contact and getting glutened. And people often ask me all of the time, will I get glutened if I kiss somebody that has eaten gluten containing food? And so they did a study on this. This was recent. It just got published. It was done a couple of years ago, but it just got published, I think, a couple months ago. And so they had 10 couples. So it was a lower number, but one person in the couple had celiac disease. The other partner did not have celiac disease. And so that partner who didn't have it ate a bunch of gluten in the form of saltine crackers. And then they either kissed right away, right? First, it was a long kiss, 60 seconds. And then they waited a certain amount of time
Was it
and
just
they
like
kissed.
on the lips though, or is there any,
No,
tongue
like French
or
kissing, like intimate.
saliva exchange? Okay.
Yeah, saliva exchange.
Okay.
Yes.
Okay. Important detail. Yeah.
And then they did another part of the study where then they had the gluten eating person, take a sip of water. So in the first part of the study, after the kissing occurred, so whether they kissed right away or waited a few minutes, all of them came back to be celiac safe except for two. All right, two samples. But the risk of harmful gluten ingestion was very, very low. So considering that this to be a very low risk scenario, not something that people with celiac disease need to be concerned about. But on the other hand, if you want to take a little bit of a layer of caution and say, I don't want any risk at all with kissing, when that partner that ate the gluten took a sip of water, all 10 samples came back to be completely celiac safe under that 20 part per million threshold, which is that current threshold of celiac safe. And so what they found is that, yes, somebody with celiac disease can kiss somebody that just had gluten and not get glutened from harmful gluten ingestion. But if you are a little bit worried about it and you're still like, well, I don't want any of that risk, then just ask your partner to take a sip of water before kissing. So a lot of people, like, prior to this, or even when they think about kissing, they ask their partner to brush their teeth. Before kissing them, they ask their partner to, avoid even eating gluten when they're going out for a date night. And so this is a big impact on people's quality of life with celiac disease. And so this research study did give us, we assumed this was a low risk scenario, but this really kind of gave us the proof in the pudding is that this is low risk. This isn't something that you can worry about. You actually can kiss your partner if they eat gluten. So I really love that study.
Okay. I think that's very valuable information and it's going to save a lot of relationships, I'm sure. So that's awesome. Okay.
Yeah, the social aspect of celiac disease. So you could go down a rabbit hole here, but there is so much anxiety and fear in celiac disease that I think dietitians are very well suited to really help break the fear, break the anxiety, and help people live a better life with celiac disease.
So yeah, just to wrap up, do you have any maybe final words, or for someone listening who, let's say, has celiac disease or is newly diagnosed. Anything you'd want them to maybe take away from today's episode? I think it might help.
Yeah. Yeah, well, I think, if you are newly diagnosed, that it's not as simple as like Googling what is gluten free. And that, if you want a sense of having more spontaneity in life, is to reach out to a celiac specialized dietitian, because they can really help to reduce that stress and reduce that fear around living gluten free. And so that would be like my ultimate go to, is don't try to do this alone. I think the support piece in celiac disease, with any condition, like an IBS as well, right, is that utilizing a specialized dietitian is key. And I say specialized is because sometimes what I hear, and you might have heard of this too, Lee, is like, I've seen a dietitian before, wasn't helpful. And I think when you get that focused care from a dietitian that really practices in that area, and that's all that we do, it can be quite life changing.
Yeah, and just to bring that, sense of calm and clarity that you are more equipped with the right things to do and what you should be doing, rather than worrying about stuff, trying to piece stuff together online, looking through Facebook groups, not being sure if what you're doing is the right choice. Just to kind of lift that weight off your shoulders by having someone you can trust as an expert, and they have the resources that can help guide you, I think, yeah, can make a world of difference. So I'm glad you shared that as well.
Yeah,
Cool.
totally.
So just to, yeah, before we end things off here, how can people maybe learn more from you, get in touch if they'd like to?
Yeah, so I would say I'm most active on Instagram. And so people can get in touch with me at Celiac Made Simple. You can search for that on Instagram or my website. You can look at my different services and book an appointment at www.selenard.com.
Awesome. So I will share all those links in the show notes if anyone wants to check those out. And thank you so much, Selena, for coming on today. We haven't talked about celiac disease specifically yet on this show, so I was really happy to chat with you. Obviously, you are the expert in it, and I learned some new things from this episode too. So thank you so much for coming on.
Thank you for having me. I loved it. It was a great conversation. So thanks.
For anyone listening, if you do have any questions for Selena or for myself, you can leave them below as well as a comment, and we'll get back to you. And if maybe you know someone who also has celiac disease and you don't, feel free to share this episode with them. And that just helps us, share this evidence-based information with other people who may be dealing with this topic as well. So thanks so much, everyone, for tuning in. Thank you, Selena, for coming on today. And that's all for now. And we'll see you over in the next episode.